You might think you know all about pink eye in cattle.
Yeah.
Sounds pretty straightforward, right? A minor irritation.
Mm-hmm.
But what if I told you that our sources reveal it's actually, well, it's this sophisticated biological battle,
Yeah,
and it comes with a truly staggering economic cost.
it really does.
So today, we're taking a deep dive into the source material you provided. We're exploring infectious bovine keratoconjunctivitis, IBK.
That's the one.
And our mission really is to pull out the important nuggets, understand the science behind it all,
Yeah, the details.
and give you a holistic kind of actionable view of this disease
Right.
because it is pervasive.
Absolutely. And what's fascinating here, I think, is that the common name, pink eye, it just sounds so simple.
Right.
But the material we've looked at, it really shows this multi-layered challenge. It hits animal welfare hard. And like you said, it dramatically impacts the bottom line for producers.
Okay, let's unpack that then.
Right.
I mean, most people probably hear pink eye and just picture a red, maybe watery eye.
Mm-hmm.
Mild irritation. But our sources, they suggest it's way more complex, maybe even a bit sinister.
Mm-hmm.
Can you walk us through what's really happening? What is IBK?
Okay, so IBK, or pink eye, it's a highly contagious disease of the eye,
Right.
primarily caused by this one bacterium, Moraxilla bovis.
Oh, no, this. Okay.
And the initial signs, yeah, they start with redness, some swelling of the conjunctiva, that's the eyelid lining,
Mm-hmm.
but then you get corneal ulceration, so actual open sores on the surface of the eye.
Ouch. Okay.
Yeah, and in the really severe cases, unfortunately, it can lead to permanent blindness.
Wow. Blindness.
And while young cattle are definitely the most susceptible,
Right. The calves.
yeah, it really can affect animals of all ages, especially, summer months, high fly populations.
The flies. We'll get back to them, I'm sure.
Oh, definitely.
So, clearly more than just a red eye then. What does this actually mean for the producers and, for the animals themselves?
Yeah.
Because that $150 million annual loss figure, that really jumped out.
It's a big number.
It sounds like the true cost is, well, a lot deeper than just the vet bill, isn't it?
Absolutely. And if we connect this to the bigger picture, like you said, that $150 million figure, it's decades old.
Oh, really?
Yeah. So it's likely a significant underrepresentation today. It actually highlights a bit of a knowledge gap, how much it's costing now.
Okay.
But the real economic sting, it comes from this sort of cascade effect. The pain, the vision loss, it makes the animals not want to eat.
Right. They back off feed.
Exactly. They reduce their appetite, reduce grazing time, and that translates directly into significantly lower weight gain.
How much lower are we talking?
Well, our sources estimate maybe 19, 20 pounds,
Yeah.
up to 40 pounds less per affected calf.
Wow.
And for animals that go blind, it could be up to 60 pounds lost by weaning.
60 pounds.
Yeah.
That's a huge hit on a calf.
It really is. It's like, losing a good chunk of profit right there. And for dairy operations, you're also looking at decreased milk production.
Okay.
And then, yeah, you add on the direct costs, medication, vet services, the labor involved,
Right. The time.
plus the devaluation of any animals that end up with permanent eye damage. It all adds up fast.
So we get the devastation, the cost.
Yeah.
But the real genius here, or maybe the villainy, seems to lie with the bacterium itself, Moraxilla bovis.
Uh-huh.
What makes this tiny little organism such a formidable opponent?
It's quite clever, unfortunately. So it's a gram-negative, rod-shaped bacterium.
Gram-negative, that means a specific cell wall type.
Exactly. Think of it as giving it a certain toughness, makes it resistant to some things, which comes up later with treatments.
Okay.
But its real power, its virulence, comes from a couple of key factors. First, it has these things called pili. They're like tiny hair-like appendages.
Like little arms.
Sort of, yeah. They act like hooks. They let the bacteria grab onto and adhere really firmly to the corneal cells, the surface of the eye.
Okay.
And there are two main types. Q. pili, which are really robust. They allow for super rapid initial attachment.
So they grab on fast.
Really fast, makes them more pathogenic. And then there are I. pili, which seem more important for kind of maintaining the colony once it's stuck there.
So it hooks on tight, and then it starts causing trouble, unleashes a toxin or something.
Precisely. It unleashes this potent cytotoxin called MBXA.
MBXA.
Yeah. And this is a game changer. It's a pore-forming exotoxin. Basically, it punches holes in the corneal epithelial cells, lyolyses them, kills them. That creates the initial little erosions, the start of the ulcer.
Okay, so direct damage from the toxin. But I read something fascinating. the way this toxin works is deeper, right? It
Yeah.
almost turns the host's own defenses against itself.
That's exactly it. This is where it gets really intriguing, biologically speaking. The MBXA toxin doesn't just destroy the eye cells directly. It's also what we call a leukotoxin.
Huko, meaning white blood cells.
Exactly. It's toxic to white blood cells. So when the host's neutrophils, those are key immune cells, the first responders rush to the eye to fight the infection.
Yeah.
Toxin lyses them too, kills the immune cells.
Oh, wow.
And when those neutrophils break apart, they release a flood of their own destructive enzymes right onto the cornea.
So the cleanup crew accidentally makes the mess worse.
In a way, yes. This enzymatic cascade leads to what vets often call a melting ulcer. It's severe tissue damage. But a large part of it is actually caused by the host's own inflammatory response going haywire.
That's incredible. The body's attempt to heal, actually, amplifies the damage.
It's a really diabolical mechanism.
So how does that impact, how we treat it, knowing the host response is part of the problem?
Well, it definitely pushes us towards using anti-inflammatories alongside the antibiotics to try and calm that damaging host response down.
Okay, that makes sense.
Yeah.
Does this bacterium have any other tricks, especially like for dodging vaccines? I know that's often a challenge.
Oh, absolutely. It has another really sophisticated strategy. Antigenic variation, particularly of its piliceae, those hooks we talked about.
It can change its hooks.
Effectively, yes. It has something called a pilin gene inversion mechanism. Think of it like it can flip a switch and change the type of pilus it's expressing on its surface.
Whoa.
So imagine the immune system makes antibodies against pilus type A.
Yeah.
The bacterium flips the switch, starts making pilus type B. Now those antibodies don't work anymore.
It's a moving target.
Exactly, a constantly moving target for the immune system. And that explains why the efficacy of many traditional pink eye vaccines has been so variable. They target pili, but the pili keep changing.
That's frustrating for producers, I bet.
Hugely. However, remember that MBXA cytotoxin?
The one that does the cell damage.
But that toxin is actually highly conserved across different strains of M. bovis. It doesn't change much.
Ah, so that's a staple target.
Potentially, yes.
Yeah.
It makes it a much more promising target for future vaccine development. A vaccine targeting the toxin might offer broader, more consistent protection.
Okay, that's hopeful. Now, it sounds like M. bovis is a master manipulator, but you mentioned it's not always working alone. The sources hint at, like, a whole crew of co-conspirators.
You're absolutely right. While M. bovis is considered the essential initiator, you need it to really kick things off.
Right.
IBK is very much what we call a polymicrobial disease. Multiple bugs involved.
Okay, like who else?
Well, another bacterium, Moraxella bovoculi, is found really frequently alongside M. bovis. Sometimes it's even more prevalent in swabs.
Bovoculi. Okay. Does it cause ulcers too?
Interestingly, no. Not on its own, but it seems to adhere to M. bovis, and it definitely looks like it contributes to the overall severity of the disease. Kind of an accomplice.
Got it. An accessory to the crime.
Pretty much. And then, complicating things even more, you have Mycoplasma species involved.
Mycoplasma, that's different from Moraxella, right?
Totally different type of bacteria, yeah. Things like Mycoplasma bovoculi and Mycoplasma bovis. And even viruses can play a role.
Viruses too.
Yeah, like the virus that causes infectious bovine rhinotracheitis, IBR. It doesn't cause pink eye, but it can predispose animals, make them more susceptible, or just make the IBK infection worse if they get it at the same time. It's a real complex interaction.
Okay, so we've met the microbial culprits, this whole gang. Let's zoom out a bit. How does this disease actually spread through a herd? Our sources point to one surprisingly critical player.
Yeah, transmission. The primary way it gets around is indirect, through what we call mechanical vectors. Meaning something physically carries the bacteria from one animal to another. And the number one culprit here is the facefly, Musca autumnalis.
Ah, the face fly. I knew they'd come up again.
They play this critical dual role. First, obviously, their mouth parts, their legs, they get contaminated with the bacteria when they feed on the eye secretions of an infected animal.
Okay, so they pick it up.
They pick it up. But second, their feeding behavior itself causes problems. They have these sharp little spines on their mouth parts.
Yep.
Yeah, and when they feed around the eye, they actually scrape the cornea, causing tiny microscopic abrasions.
No way.
Yeah, and those little abrasions create the perfect entry point for the bacteria they're carrying.
So the fly isn't just the taxi, it's also roughing up the landing spot, like a tiny, unwitting accomplice creating the wound.
That's a great analogy. It really preps the site for infection. Quite a partnership.
Wow. And it's not just the flies bringing it in from infected animals, is it? I read about animals being silent spreaders, too.
Indeed. That's a critical point, the existence of asymptomatic carriers.
Carriers.
Yeah.
Meaning they have the bacteria but don't look sick.
Exactly. Cattle that have recovered from pink eye, or maybe were just exposed and fought it off without ever showing signs, they can still harbor M. bovis and M. bovoculi in their eyes, even in their nasal cavities, for a long time.
And they're shedding it.
Continuously shedding bacteria. This is a major, major reason why completely eradicating pink eye from a herd or even an area is practically impossible. There are always these hidden reservoirs.
That makes control really tough then. Okay, so beyond the flies and these silent carriers, what about the environment? What kind of conditions or physical things make it easier for pink eye to take hold?
Several factors definitely roll out the welcome mat. Intense UV radiation, bright sunlight can damage the cornea, make it more vulnerable.
Sunburn for the eye, almost.
Sort of, yeah. Then you have physical irritants. Just think about anything that can scratch or bother the eye. Dust, sand, pollen.
Tall grass.
Tall grasses, weeds, yeah. Even the way animals feed, like sticking their heads into large round bales, can cause abrasions.
Okay.
And then there are chemical irritants too. High ammonia levels, like in poorly ventilated barns, can irritate the eyes and weaken their defenses.
Makes sense. And what about the cattle themselves? Are some just naturally more likely to get it, certain breeds or types?
Yes, definitely some host-specific risk factors. Breed is one. Cattle that lack pigment on their eyelids, think Herefords, some Charolais, some Holsteins.
The white-faced ones often?
Often, yeah. That lack of pigment makes their eyes more susceptible to UV damage from the sun.
Okay.
Age is a big one, too. Young calves, they're immunologically naive, their immune systems aren't fully developed. They're far more susceptible than older cattle who've maybe been exposed before and built up some local immunity in the eye.
Right.
Nutrition plays a role. Deficiencies in things like vitamin A, copper, selenium, these can compromise immune function generally, making them less able to fight off infection.
So good minerals are key.
Absolutely. And finally, stress. Anything that stresses the animal, weaning, transport, mixing groups together can suppress their immune system and leave them wide open to infection.
Okay, so a lot of factors contributing. Now, once an animal is infected, what does it typically look like? How does it progress? Our sources broke it down into stages, almost like escalating battles in the eye.
That's a really good way to put it. Vets usually divide the clinical progression into 4 stages. Stage I, you see those first signs of irritation. Excessive tearing, the animal's squinting, sensitive to light, the conjunctiva looks red, and you might see a tiny opaque white or gray spot on the cornea. That's the very beginning of the ulcer. And the eye starts looking a bit cloudy or hazy.
Okay, prognosis then.
At stage 1. Excellent if you catch it and treat it early.
Good. What about stage 2?
Stage 2, that ulcer starts to expand, gets bigger, the cloudiness across the cornea becomes much more pronounced. And then you start to see neovascularization.
Neovascular what now?
Neovascularization. It means new blood vessels start growing across the surface of the cornea towards the ulcer.
Ah, is that what makes it look pink?
That's exactly where the name pink eye comes from. Those blood vessels give it that characteristic pink appearance. Vision is definitely compromised at this stage, but the prognosis is still generally good to very good with treatment.
Okay, so that's the pink in pink eye. Then it gets worse. Stage 3.
Yeah, stage 3, the ulcer covers a large part of the cornea. The inflammation is severe now, extending deeper into the eye, something called uveitis. You might even see pus accumulating in the front chamber of the eye, giving it a yellowish look.
Oof, sounds painful.
Extremely painful. The animal will likely hold its eye completely shut. At this point, the prognosis becomes guarded. Significant scarring and some permanent vision impairment are very likely, even with treatment.
And the worst case, stage 4.
Stage 4 is the most severe. This is where the cornea can actually rupture.
Rupture.
Yeah, the ulcer goes all the way through. The fluid inside the eye, the aqueous humor leaks out. The iris might even prolapse, push through the hole. It inevitably leads to permanent vision loss, complete blindness in that eye.
Wow.
Prognosis for vision at stage 4 is grave. There's really no saving sight at that point.
Okay, that progression is pretty alarming. So with all this complexity, when pink eye does strike on a farm, how do vets actually diagnose it? Is it just visual or?
Often, the diagnosis starts with those characteristic clinical signs you see, plus the context, is it fly season? Are multiple animals affected?
Right.
But for a definitive diagnosis, especially if you want to guide treatment effectively, you'd take an ocular swab.
Swab the eye.
Gently, yes. Send it to the lab for bacterial culture. That not only confirms M. bovis or M. bovoculi, but importantly allows for antimicrobial susceptibility testing.
Ah, so you know which antibiotics will actually work.
Exactly. Avoids using something the bacteria might be resistant to. PCR testing is also used. It's very sensitive, can detect the bacterial DNA, even multiple pathogens at once.
Okay. Any other tools?
A simple but crucial one is fluorescein staining. It's a special dye you put in the eye. Any ulcerated areas will absorb the dye and glow green under a specific light. Really helps visualize the extent of the damage.
Cool. All right, so you've got the diagnosis. What's the immediate plan? Treatment.
Early intervention is absolutely key. The sooner you treat, the better the outcome, the less spread.
Makes sense.
What?
Antibiotics.
Yes, antibiotics are the mainstay. Usually systemic, long-acting injectables are preferred. Things like oxytetracycline, tulathromycin, chlorphenicol, they circulate through the body and reach the eye.
So one shot often does it.
Often sufficient, yes, especially if caught early. Topical ointments put directly in the eye exist, but they're generally less practical in cattle. You'd have to catch and reapply them frequently.
Right, not easy in a herd situation.
Not at all. There's also subconjunctival injecting antibiotic, often penicillin, right under the lining of the eyelid. It's effective, puts high concentration right when needed, but it's more technically demanding to do correctly.
Okay. Anything besides antibiotics? You mentioned inflammation.
Yes, addressing the pain and inflammation is vital. So using non-steroidal anti-inflammatory drugs, NSAIDs like Flunix and Meglamin, that really helps with comfort and can reduce some of that damaging inflammation.
Good. But not steroids, right?
Critically important, avoid corticosteroids if there's a corneal ulcer present. Steroids can suppress the immune response needed for healing and actually delay or worsen the ulcer healing significantly. Big no-no with ulcers.
Got it. No steroids for ulcers? What about supportive care?
Definitely important. Protective eye patches are great. They shield the eye from sunlight, dust, flies, irritants.
Like a little eye bandage.
Exactly. And they can also help reduce transmission, physically blocking flies from feeding on the secretions. Isolating the affected animals from the main herd is also highly recommended, again, to limit spread.
Okay, so treating the sick ones is crucial. But it sounds like winning the war against pink eye isn't just about fighting fires, right? Our sources really stress being proactive, a whole prevention plan.
Absolutely. Given how complex this is, the bacteria, the flies, the environment, the host factors, you simply cannot rely on one single thing. Effective control demands a comprehensive, integrated approach.
So what does that integrated blueprint look like? What's step one?
The absolute cornerstone, according to our sources, is comprehensive, season-long vector control, tackling those face flies.
Okay, how?
It has to be multimodal, not just one method. You use insecticide-impregnated ear tags.
The fly tags.
Yep. But crucially, you need to rotate the chemical class of insecticide used in those tags each year.
Why rotate?
To prevent or slow down the development of insecticide resistance in the fly population. If you use the same chemical year after year, the flies that survive pass on their resistance.
Smart. Okay, tags. What else?
Pour on or spray insecticides applied directly to the animals. Self-application devices like dust bags or back rubbers that cattle treat themselves with. And feed through insect growth regulators, IGRs.
What do those do?
Things like altosity. The cattle eat it, it passes through into their manure, and it prevents the fly larvae in the manure from developing into adult flies. Breaks the life cycle right there.
Wow, attacking them in the manure. That's thorough.
You need that multi-pronged attack on flies all season long.
Okay, flies under control. What's next? The environment.
Exactly. Proactive environmental and pasture management. Anything to minimize eye irritation. Keep pastures mowed short so grass seeds aren't poking eyes. Control dust in dry lots, maybe by spraying water.
Shade. You mentioned UV.
Absolutely critical.
Yeah.
Provide adequate shade. It releases that damaging UV exposure. And even thinking about feeder design, making sure they're safe, not likely to cause eye scratches.
Right, so manage the flies, manage the environment. What about vaccines? Are they the silver bullet or just like one tool in the box?
Definitely a tool, but absolutely not a standalone solution. Vaccination needs to be strategic and ideally guided by diagnostics.
Okay.
We have commercial bacterins, those are killed M. bovis vaccines, usually targeting polyantigens, but like we discussed, because of that pilus variation.
So effectiveness varies.
Right,
Yeah.
exactly.
That's
Then you have autogenous vectorins. These are custom-made vaccines created from bacterial isolates taken directly from animals on a specific farm.
Tailor-made for that farm's bugs.
Precisely. If they match the strains actually circulating on that farm, They can be more effective than off-the-shelf commercial ones.
Interesting. And the toxin-based ones you mentioned earlier.
Those subunit vaccines, especially the ones targeting the MBXA cytotoxin, are really promising. Because that toxin is so conserved, so stable across strains, they have the potential to offer much broader, more reliable protection. Still developing, but promising.
And timing matters for vaccination.
Critically, you need to vaccinate well before the high-risk season starts, usually late spring, to give the animals time to build immunity before the flies and UV radiation peak.
Okay, so we can fight the flies, fix the environment, vaccinate strategically. Can we also, like, breed tougher cattle?
Yes. Prioritizing host-specific risk reduction is the next piece. Genetic selection for cattle with pigmented eyelids is a long-term strategy.
Choose bulls that throw calves with dark eyelids.
Exactly. Ensure optimal nutrition. Back to that vitamin A, copper, selenium. Keep the immune system strong. Manage stress. Handle weaning, transport, commingling carefully to minimize immune suppression.
And finally,
Vigilant monitoring and early intervention. Constantly watching the herd for those very first signs of tearing or squinting. And then prompt treatment, systemic antibiotics, eye patch to stop the disease progression in that animal and limit spread to others. It's really about combining all these things.
it's a lot to juggle. Flies, environment, vaccines, genetics, nutrition, stress, monitoring.
It is. There's no single magic bullet for pink eye. It requires this layered, integrated approach.
And this whole discussion, especially around antibiotics, it brings us to one last critical point, doesn't it?
Yeah.
Something with broader implications beyond just cattle health.
It absolutely does, and it's a really important one. The widespread use of antibiotics to treat pink eye raises significant concerns about antimicrobial resistance.
AMR.
Resistance in the Moraxella bacteria themselves.
Yes. Strains resistant to common antibiotics have already been documented. And because IBK, while costly and painful, is rarely fatal.
The decision to use antibiotics is often driven by economics preventing weight loss rather than saving the animal's life. This can lead to potential overuse or maybe less targeted use.
Creating more pressure for resistance to develop.
Exactly, selection pressure. So there's a real need for a strategic shift towards prevention, using all those non-antibiotic measures we talked about: fly control, environment, vaccination, genetics. It's crucial not just for controlling IBK more sustainably.
But for protecting those antibiotics.
Precisely. For preserving the effectiveness of these medically important antibiotics for both animal and human health down the road. It's part of that bigger One Health picture.
So wrapping this up, what does this all mean for you, the listener? We've really peeled back the layers on pink eye, haven't we? It's clearly not some simple little ailment. It's this complex, costly interplay between a very clever bacterium, a problematic fly, all these environmental triggers, and the animal's own biology and susceptibility. It costs the industry a fortune, causes real animal suffering. But the good news is, by truly understanding this multifaceted nature, we can move beyond just reacting. We can implement these proactive, integrated strategies that really make a difference for the animal's welfare and for the producer's bottom line.
And if we connect this to the bigger picture, this whole ongoing challenge with pink eye in cattle, it really underscores a broader lesson, I think, that in agriculture, maybe in life in general, the most impactful solutions often aren't those single-point interventions, the magic bullets.
Right.
They're usually these holistic, adaptable approaches, strategies that respect the intricate dance between the biology, the environment, and how we manage things. And it makes you wonder, doesn't it? What other seemingly simple problems out there might actually have similarly complex, interconnected solutions just waiting for us to uncover?